Good afternoon, everyone. We are now about to begin the session 2 in about 2 minutes later. May I please invite the participants who are still outside of the conference room, kindly take a seat inside as we are about to start. As we discussed on the session 1, we had a wonderful session, and now we are about to start the session 2, which is also about developing a strategy to foster synergies between trade and health, pandemic prevention, preparedness, and response. We also discussed a little about the lesson learned of the COVID-19 on the session 1. And in this session, we will dive into that. And this session, we will discuss a little bit more about the pandemic prevention, preparedness, and response. Clearly need synergies between trade and health at all levels. Also, this session, we'll discuss how the trade and health sectors can also work together on issues related to trade and health under the new WHO pandemic agreement. To provide us with more details, may I please introduce the panelists and moderators of this session. Please welcome the moderator of this session, Dr. Manisha Shetha, Regional Advisor, WHO Southeast Asia, Regional Office, to the stage. Please welcome.
Good morning, everyone, and welcome to the next session. It is my privilege to request our speakers for this session. Dr. Sherman Weleski, I welcome you on stage, please. Thank you. Let's give him a big hand. Dr. Nilesh Budh will join us virtually and give us his presentation. And I request Dr. Priscilla Maria Diaz. Is that all right? Thank you. From the World Intellectual Property Organization, and I welcome you on stage too. So I welcome each one of you for this very important discussion on developing a strategy to foster synergies between trade and health, and that is where the pandemic prevention, preparedness, and response, our proposed pandemic agreement, which is such an important agreement we are now discussing in WHO, is going to be discussed. We have a very illustrious panel, and it is my privilege to introduce to you Dr. Sherman Weleski, whom I have known for many years in WHO, and I have been very lucky to work with him when he was in Geneva. He has, I'm sure his bio is with all of you, but he has many firsts to his credit. He's currently working with the South Center, and he is the Special Advisor for Health and Development in the South Center. And this is based in Geneva. He was also looking in WHO. He was working on the area of IP and access to medicines, and has been responsible for many of the negotiations under the TRIPS agreement from the year 2001 to 2010. So a lot of the things that we are discussing, Sherman will be able to add and also take us forward on that. I have with me Dr. Nilesh Budh, and I'm grateful to him for agreeing to join virtually. He was on leave, and he has just joined this morning. So thanks, Nilesh, for joining us. He's the lead regional emergencies in the Southeast Asia Regional Office of CIRO, and he's working very in-depth on the interface of the IHR and the pandemic agreement. And he really has the latest information on how the different member states are looking at this agreement and how they are planning to move forward on this agenda. So I'm quite sure that Dr. Nilesh will throw a lot of light on how the agreement is moving forward. And I'm also very happy to have with us Priscilla, who's a researcher, lawyer, and she's working with WIPO. She has a doctorate from McGill University, Faculty of Law, and a master's degree in international and comparative law from the University of Sao Paulo. And she can speak English, Spanish, and French, and Portuguese as well. I thought that was really something, being fluent in 4 languages. So so I welcome the panel. And to begin with, I understand that we will have Dr. Sherman Wiliski, who will give us an introduction on the pandemic treaty and how the pandemic treaty is being negotiated and what are the issues behind it. Just by way of introduction, I think we need to focus that this will be the second treaty agreement that WHO is negotiating. Before that, WHO has one treaty, which is the Framework Convention on Tobacco Control. In fact, one of the discussions was that why is it WHO has not engaged more on its rule-making powers before? This is just the second treaty that WHO is looking at. This is under Article 19 of the WHO Constitution. And when we look at our regulations, the IHR regulations, the International Health Regulations, they are under Article 21. And they define some of the sanitary and phytosanitary measures where these agreements, IHR, under which IHR and the erstwhile sanitary agreements were concluded. The one that the Director General also mentioned in his opening speech, the first agreement having taken place in 1851. And then we have the World Health Assembly resolutions every year, which is under Article 23, which are non-binding agreements, but the member states have aspirations to move in that direction. The advantages of a treaty is that it is a legal obligation that parties to the convention are bound by, and they agree to carry them forward. So just as a discussion, I thought it is necessary to place where we are trying to negotiate and how important this treaty is, and this proposed agreement is. So with these words, I hand it over to you, Dr. Sherman, to take us forward in these discussions. Over.
Okay, thank you very much. I am very pleased to be here in this beautiful country. It's not my first time. I came several times. I am so pleased that you are the moderator of this panel because you know me since a long time and you know my views, and we didn't interact in the last few years, but I still have very strong views to all the things that have been discussed here, especially particular this morning. I have a very friendly relations. It's very long time with Roger Camps from WTO. We have been interacting in many countries in Asia, in Latin America, in Africa, in different conferences. And I have to say very friendly and nicely that I disagree in many of the things that you said this morning. Particularly, I was very surprised when you say this morning that WTO rules promote equity on access to health. I mean, that I have been traveling a lot as you, and I am not seeing that WTO are promoting access to medicines. In my own country, in Colombia, the WTO rules, the TRIPS rules, have been a barrier to make a compulsory license that the government has been since 5 years trying to use it. And you say also that countries are not using the flexibilities of the TRIPS agreement. I think that in part of your research was also why they are not using. I know very well many countries, including India, in Thailand, what the countries were not using because there was a lot of pressure from the European Union, a lot of pressure from the US. There was a letter for the vice president, or at that time, vice president of the United States to the president of Colombia, asking not to issue a compulsory license. It's a very interesting case because the letter is the actual President Biden. He was vice president at that time, and he was requesting the Colombian government not to use the flexibilities of the triple agreement of a medicine that was not from US. It was a Swiss medicine. So you say why the US was trying to stop a compulsory licensing in Colombia that was going to be issued to a Swiss company, and was the US government opposing. So I think that the questions are quite complex, and we are seeing this day that in the context of the negotiation of the famous pandemic treaty since already 3 years, that there was a failure according to the plan time that they used to. See why I can manage the papers at the microphone, I hope. I attend the conference that was mentioned this morning, that Thailand is really leading the promotion of the dialogue between trade and health. I attend the first conference in 2014, and now 10 years after, we can ask, there has been a progress or not? And I suppose, and I see here in this meeting this morning, that there has been a lot of progress in Thailand, for sure. The proof is that 10 years after we are having this conversation here, there has been a lot of progress in the region. But if I look globally, in Latin America and in Africa, there have been these kind of exercises that are quite important. In some countries, I quote again the experience in Colombia, the Ministry of Health was the one trying to issue the compulsory license, and the Ministry of Trade was totally against. And they managed to stop so there is very little collaboration in many countries in trade, and what is happening in the region is very interesting, and will be interesting if WHO try to promote the same exercise in other continents, in other countries. So at the global level, even in Geneva, I think in Geneva level, I am talking about the different organizations involved in this debate. I think that the progress, in my opinion, has been very little progress. I know that, and I am observing in the periodical meetings that they have, the three main organizations, WHO, WIPO, and WTO. But the fact is that the trade rules are binding rules, still binding rules. And when I am talking about trade rules, is the norms and rules to move goods, banana, rice, cotton, oil. So they are binding rules that you can enforce through legal actions. In health, nothing is binding. Nothing is binding. All recommendations, voluntary recommendations. And that is a problem. I mean, even if the three organizations are meeting periodically, the fact, the reality, and we are going to see in the present negotiation of the pandemic treaty, this is one of the problems. The developed countries, they don't want any binding instrument in the treaty. Let's go to the next. Who is moving, or I am supposed to move? Can you move from? So, what is the today international negotiating environment? You see, some 30 years ago, they were only, at the global level, mainly one actor was WHO, the only actor. At the country level was only the Minister of Health, and in certain way, the UNICEF was involved in certain negotiations, but related to vaccination and not other things. Today, there is a proliferation of actors. You see in the screen, WTO, UNICEF, UNAIDS, UNITAID, UNDP, etc. And you had in red the G7. It's interesting that after the pandemic, the G7, they have a chapter in the report that they issue after every meeting. They have a chapter on health. So my reflection will be: do you think that if the G7 decide, the G7, the richest countries in the world, they decide that they are going to move in this direction, do you think that these particular countries, members of the G7, are going to advocate for something different at WHO? I don't think so. I mean, the rules are already fixed. So this is a very, very serious thing if the multilateral debate is going to be restricted and the decisions are going to be taken at the level of the G7. There is a trend also very, very strong to move in a kind of some public-private mix on health. I am not against in the participation of the private sector on all issues, but my concern is who is going to put the rules, who is going to find the way to avoid any conflict of interest, because as far as I know, particularly in the pharmaceutical sector, the pharmaceutical companies are looking for money, are looking for profit. They are not looking for the health of the people. They are not, as we saw in the last pandemic. The COVAX decide to distribute very, very rational in a public health perspective to cover 10% of the population of all countries, and at the end, the vaccines were bought by the industrialized countries. 90% of the vaccines they were to the industrialized countries. Next, please. So, what was the idea of the Biden International Pandemic Treaty? The idea was the Biden Treaty to avoid repeating the failures that occurred during COVID-19. During these 3 years, we know that they were things that were functioning quite well. And others, like all the IP issues, were really a barrier to access to these vaccines. Next, please. This cartoon illustrates very well what happened. The vaccines developed by the industrialized countries, basically Europe and the US, they were developed, they were distributed and bought by the North and not by the South. And 90% of the vaccines were at the North, and in Africa, less than 10% of the people were vaccinated. The Director General of WHO made a very, very strong statement saying that there was a health apartheid, referring to the distribution of the vaccine during the COVID-19. It's quite a strong statement to call a real apartheid. Next, please. Well, let's recall some facts that are interesting to recall. On the 30 March 21st, the European Union and WHO and 25 countries, they called to start the negotiation of a treaty. These 25 countries were mainly developed countries. So they were calling and they were initiating, they were calling the initiation of the negotiation for a treaty. At the same time, the request of the waiver, I call it waiver because the request for a waiver, you say, Roger, that the result was not the waiver. It's true, but the request of India and South Africa and more than 100 countries, they were requesting for a waiver. At the end, there was not a waiver. It's interesting how many European countries, they were asking for the negotiation of the pandemic binding treaty, when in the WTO at the same time they were refusing to give the waiver. We saw in the last World Health Assembly the country recognized that there was a failure of negotiation in the time that it was planned at the beginning. So now we don't know when is going to the World Health Assembly this year called for a continuation of the negotiation. We don't know until when. The negotiation, the last round started today in WHO. They may finish in the next 2 weeks and have a World Health Assembly as was announced in December, extraordinary World Health Assembly to approve the treaty, or they go until May next year in the next World Health Assembly. Next, please. Well, what is the problem with the present draft, the draft that they are starting to discuss this morning? The current draft text of the pandemic treaty is far from a draft of the Biden treaty. It's a draft of the friendly, voluntary agreement. It's like the World Health Assembly resolution that the Assembly is passing every year, 20, 30 World Health Assembly resolutions that are not binding resolutions, are only a voluntary hopes. The present text, for example, they say to promote when appropriated. What is that in a treaty? To promote when appropriated. I mean, it's a hope. This is a language of many World Health Assembly resolutions to promote as appropriated. The as appropriated is always a request by the US. As appropriated, what as appropriated for whom? From the majority of the people in the world, or from the pharmaceutical industry? Are appropriated. It's very strange language. So my point is that this language, the language that they are discussing now, is not the language of a treaty. It's a language of a voluntary agreement. Next, please. I was last week in a very interesting meeting with I learned a lot in Senegal. The French government organized a meeting with all African French-speaking countries, and they were talking about the OSH by all, the One Sustainable Health by all, and there is a push from the French government to include in the language somewhere in the treaty to include this concept. Interesting. I mean, apparently there are many French African countries that are already promoting and trying to push WHO to adopt this concept. I am not very sure what is the difference with the health for all that Dr. Sweet not very well 40 years ago the WHO was promoting. I don't know what is the problem of the French government with that they want to replace the concept of global health. They want now the one sustainable health by all, not for all. Apparently, they changed. Before was for all, now it's by all. As far as I understood in this meeting, I see 3 problems with this concept, with the One Health concept. First, the treaty will be out of WHO because will involve other international organizations that are not going to be coordinated by WHO. There's no sense. So it's not the first time in the history that happened that to WHO. I mean, remember 30 years ago when the most important health problem at that time, the AIDS problem, the debate and in the moment of the more serious situation conclude with the creation of a different organization, UNAIDS, and they took out the AIDS problem. I am going to leave this thing out. They took out the AIDS problem. What happened after with the vaccination program that was one of the most successful programs in WHO? They took out and they created Gavi, that is a public-private partnership, After that, Director General Brundtland came to WHO and was trying to create the Global Fund as a kind of mechanism to found the organization. When they reached the agreement, they took out the Global Fund from WHO. What happened with COVAX? With COVAX was the way to found the vaccines when the vaccines were going to be developed, and they took out the COVAX. The WHO was only an observer. What happened now with the pandemic treaty? There is already a pandemic fund that is not in WHO, it's in the global, it's in the World Bank in Washington. So and now the treaty is being negotiated in WHO, but the money is already in the World Bank. So I have the impression, more than the impression, I am giving some proofs, that in the industrialized, many developed countries, they are trying to weaken WHO in every time that there is a crisis. That is very serious. The second issue on the health for one sustainable health for all is that there will be a voluntary agreement. They are saying that there's going to be a collaboration between different platforms, public, private, a collaboration, but there is going to be a voluntary collaboration. And which is going to be implemented by the public and private platforms. So if that is going to be the push from several countries in the context of the global the pandemic treaty, I think that is a big problem. Can I have the next, please? Well, at the end, this is a labyrinth. The developing countries, they are trying to improve access to these vaccines and treatments and diagnostics, and we see that in the pandemic treaty is quite complex and sometimes confused. There are many elements that there is no need for a treaty. I mean, and there are several things that were working well during the pandemic. I am thinking of, for example, the bio-sharing. China gave in some 2 or 3 weeks the genome of the virus was for that the vaccines were produced so quickly. So and in addition to that, they were during 3 years a parallel negotiation on the international health regulations and in the treaty in different groups that was confused and was misleading, and sometimes they were requesting for something in one group and saying, don't worry, it's going to be in the other panel, and at the very end they approved the international health regulations, and the industrialized countries offered to mention in a kind of chapeau or in the text terms like solidarity or equity. Can I have the next, please? I am going to come back to the solidarity and equity that was mentioned, is mentioned in the international health regulation. But during this negotiation in the last 3 years, something already happened, or is it almost the concept of essential medicines has been one of the most successful concepts of the WHO in the history of the WHO in the last 30, 40 years. Many countries in the world are formulating national drug policies based in the concept of essential medicines. Now, in the language and the debate of the treaty, they are changing the essential drug medicines, because essential drug medicines are covering vaccines, treatment, diagnostics, have been always the case. Now, the argument is that it's better to use medical contrameasures. Well, medical contrameasure is a commercial language and not the language of essential medicines that had the connotation of a public goods or even human rights. The next, please. Yeah, is that so? To put in the chapeau of the international health regulations in any chapter or even in the I think that is not enough. We have to call more about. We have to talk about justice, and justice it have to be enforced through the legal mechanism. Next, please. One ambassador from the European country told me several weeks ago, what we have is better than nothing. You mentioned, Roger, also this morning that probably better something than nothing. I will say that I will prefer nothing what we have, but what we have, it will not serve for, in any case, to face the next pandemic. Next, please. Finally, I think that if in this World Health Assembly that is going to take place in December or in May next year, I think that we have to recall that the WHO is still a democratic organization and there's still the possibility to vote. So I will think that in many issues of the treaty, particular in all the substantive issues, in my opinion, that are the intellectual property issues, the way will be to vote. I think that is the final. Yeah, thank you very much. I wanted only to add that in the Summit of the Future, that the Pact of the Future was approved a few weeks ago in New York, there is a very, very little about intellectual property, as there is a very, very little about human rights. The US requests to withdraw all the reference to human rights. In the 21st century, there is a country that is requesting to withdraw reference to human rights. I mean, it's something quite difficult for me to understand. And there is very little also on education, almost nothing. All the people following the education, NGOs and many others, they were complaining that there was very little about the education, and education is the base to face the tragedy, the main tragedy today, that is the climate change and the environment problem. Thank you very much.
Thank you, Raman, and I thank you for all your comments. In fact, some of the very important point you made was that Thailand is leading the dialogue on trade and health, and we really need in WHO to promote that in many other regions, and I think that is very critical. And for this, Dr. Sampan, Chaim, and the whole team here deserve a big round of applause, because this is something they're doing which nobody else is doing, trying to look for solutions in a very difficult space. Another very important point, sir, you made was with respect to the COVAX distribution challenges, which we need to keep in mind when we are looking at the pandemic treaty and the discussions that are taking place. And you've pointed out all the strong challenges that we need to look at when the agreement is being negotiated, and that is work in progress. So thank you so much for your presentation. I will request Dr. Nilesh to go next, and thank you, Nilesh, for agreeing to join us on the very first hour that you are back after your leave. So thank you, and I would request you to make a 10 to 15 minute presentation. Dr. Nilesh is working on the interface of IHR and the pandemic treaty, so he is best placed to tell us where the two meet and where the two treaties, the proposed agreement and the IHR, what is the domain and the space that they are proposing to cover. So over to you, Nilesh, and thanks again.
Thank you, Manisha. Good morning, distinguished panelists and participants. Thank you very much for inviting me for this important conference. I will try to bring the IHR perspective and pandemic agreement perspective from the WHO side. So Manisha, please confirm if you can see my slides in the slideshow mode.
You have to make it slideshow, Nilesh, otherwise we can hear you perfectly well. Thank you.
I tried, but I can see the slideshow mode already. Is it okay if I go ahead with this one?
So you have to exit first and then share again.
Okay, let me try again. Stop share. then share again.
Can you show the slide, please? Click the.
At least on my screen, it is slideshow. If you can confirm that you can see the slide, then I can go ahead.
Actually, you have to click like share. When you're sharing, you have to share on the full screen mode, not the PowerPoint one.
Yeah. Messenger.
Or maybe you can click like share screen instead of the PowerPoint.
Your screen sharing.
Or would you like us to open the file for you?
If you have this, I made some minor adjustment, but if you have my slides, please go ahead.
Okay, moment please.
Okay, next one. Yeah, so basically, all of these IHR agreement discussions and the pandemic agreement discussions emerge from the experience of the COVID-19 by the world. Lot of socio-economic loss. I don't need to go in the figures, how many billions were lost and how many lives were lost, but several different types of high-level reviews took place following the COVID-19 experience, and they made more than 300 recommendations to improve the international health emergency preparedness and response system. And this is at the heart of it, the circle that here you see, which pandemic accord or agreement which is being proposed. And then WHO came up with a new HEPR framework, Health Emergency Preparedness and Response Framework, which has governance, technical systems, and financing. Some of these we already touched upon in the earlier Mr. German's talk, where equity, inclusivity, and coherence are at the core. WHO with 196 member states and still a democratic institutions provide equitable platform. There is a possibility of vote. Next one. This is the timeline. I am trying to bring both IHR and the pandemic agreement discussions simultaneously. Of course, some of these discussions and negotiations were quite confusing. Where should it fall? But in last 2-3 years, these different groups established by the World Health Assembly, where all member states were part of it. They worked on it through several meetings and intersessional informal sessions to discuss various aspects of it. Thankfully, next slide, please. Thankfully, the IHR agreement took place in spite of the current geopolitical scenario, various conflicts and developed and developing countries' positions. This is the moment where entire text of the IHR amendments were agreed upon, although there were various adjustments and compromise, but the important point is that in spite of all these challenges, still the global health diplomacy works, and it worked. And now we have the new IHR amendments, which is better than the previous one, which has incorporated the COVID-19 response experience, how to improve the systems and how to strengthen the prevention of international spread of diseases and to prevent unnecessary travel and trade restrictions. Next, please. These are the key amendments that is now part of the new text. There is a 1-year period which will end in September 2025, by which if any member state want to register its reservations, they are free to do so. However, all of them have agreed in May 2024 for this very text. And the key new elements are establishment of a national IHR authority. And WHO, as the secretariat, is currently working to develop the guidance around national IHR authority. Basically, the idea is that these national IHR authority should be empowered to do intersectoral coordination within the country. Earlier, usually the national IHR focal point were a mid-level to senior level MOH, Ministry of Health person, and many times they required various types of approvals depending on the system of a country. But now it is proposed that the National IHR Authority will have the authority, will be empowered by the law of the country to be able to implement the IHR. Then there is determination and definition of a pandemic emergency. So far, we did not have even the definition of pandemic emergency, which now all 196 member states have agreed that when do we call a pandemic emergency, and accordingly we can prepare our systems to get ready. And then, as Mr. German mentioned, there is various references to commitment to solidarity and equity in the new IHR amendments. Although it is not the best text and it is not as legally binding treaty that pandemic agreement is supposed to be, but still it is better than nothing, strengthening access to relevant health products. Here the word medical countermeasures is not there, and also essential medicine is not there, but relevant health products is there, which is also, we can argue, that is a commercial language. And then establishment of coordinating financial mechanism. Now, pandemic fund was established and is currently housed in the World Bank as the trust. But there is this, in Article 44 bis of the IHR amendments, there is a clause on establishment of coordinating financial mechanism to help developing countries to build their capacities for international health regulation implementation, because it requires a lot of resources for strengthening capacities of developing countries to be able to implement IHR. And then there is a possibility of using both non-digital and digital health documents, which is quite good. And the last one, establishment of a states party committee, which is like all member states, for the implementation of IHR, which is quite a significant achievement and agreement, I would say. But we are also watching the developments, similar developments in the pandemic agreement negotiation, what kind of governance mechanism emerges out of that, and how best to synergize these both governance mechanism of IHR amendments and possibility of a pandemic agreement. Next, please. So this is National IHR Authority, as I mentioned. In the interest of time, I will go ahead, please. Next. This is the definition of pandemic emergency, which is mainly the communicable disease when it is beyond the capacity of health systems of a particular member state to respond. It's a very elaborate definition, and Director General will follow these definition before declaration of such an emergency. Next. So when Director General wants to declare a pandemic emergency, he will consider the PHEIC criteria, which is now quite well known, public health emergency of international concern, and also the new definition of pandemic emergency, and then advice of the emergency committee of the IHR, which is a body of global experts that advise the Director General. Next, please. This is a important addition of relevant health products, access to, equitable access to. Now, the important point is how to materialize, how to implement, how to concretize it. And it does create obligations for both WHO and member states to facilitate equitable access to such products. However, agreement could not be reached on specific wording on technology transfer, which is now, is one of the main point of negotiation in the pandemic agreement, and I'll come to it in a minute. Next, please. This is strengthened obligations on state parties to support and assist each other. Again, the spirit of the IHR, although it says legally binding international health regulations, they still need a pandemic agreement, which is under the Article 19 of WHO as the FCTC. Next, please. This is coordinating financial mechanism. Again, the terms of reference of these will be established in the first meeting of the state parties, which is all state parties. And these coordinating financial mechanism will be accountable to the World Health Assembly. So the devil lies in the details, as we all know, and this was included as a new Article 44 bis, but it doesn't include the establishment of a new fund, which was a key point of debate. But it does include that the international health regulations will work to mobilize new and additional financial resources for building capacities for preparedness and response. Next, please. This is a bit of an overview of what are the key amendments in the new IHR. There is a new governance mechanism, as I mentioned earlier. There is a committee of the whole, which is all member states parties committee. And then there is also a smaller expert committee as part of that entire state parties committee. And that committee itself in their first meeting will work out the details, TOR, and the governance mechanism of coordinating financial mechanism. Both the financial mechanism and the state parties, they will work closely with the WHA, World Health Assembly. But again, that relationship between both entities will need to be worked out. Next, please. There is now explicit inclusion of prevention and preparedness in the core capacities that are very much part of the IHR. This is, again, a significant technical achievement to be explicitly mentioned, because as you know, these capacities are reported by the member states on annual basis. It's a mandatory requirement. And then there is also joint external evaluation of these capacities. So it's very important to include these, and they have now expanded it. Next, please. These, of course, the member state Indonesia of Southeast Asia region represented in the bureau for the entire Southeast Asia. There are significant new inclusions, and the member states of Southeast Asia region actively participated in this. And we are moving forward on various technical tools development, briefing of ministries of health, etc., to better understand implications of these new amendments, and how to move forward in implementing this. Of course, a couple of key amendments need to be aligned with the discussions on the pandemic agreement. Next, please. This is how Secretariat is planning for the entire year to develop various tools to uh, help member states in implementing the new IHR. Next. This is, so I have hidden various slides. Please go ahead. Next, I want to go to the pandemic agreement part. Go ahead, go ahead. These are various different statistics of our own IHR capacities, which I mean, for Southeast Asia region, which I have actually hidden in my presentation. I cannot do the slides. So go ahead, please. Come to the pandemic agreement part. Please go ahead. Yes, the previous one, previous one. Yes. So just to touch base again on pandemic agreement, now there have been 11 formal meetings, and the 12th meeting is starting today for next 2 weeks. Dr. Viroj of Thailand represents the Southeast Asia region in the INB Bureau, Intergovernmental Negotiating Body. He also briefed ministers of health during our last regional committee before a month about the key aspects of the pandemic agreement. There have been several draft texts. There have been public hearings and engagement with other stakeholders. The next slide, please. The current text, most of that, although as Mr. German mentioned, it may look to an expert eye as not a legally binding treaty, but a voluntary agreement. Nevertheless, most of that is greened, means agreed upon, or is yellowed, means it is in the process of agreement, except couple of key articles, which I will just mention in the next slide. It's about, these are major outstanding issues as of now. The developed countries very much want One Health, but developing countries are suggesting to have it as a separate instrument. And Mr. German did mention about this now as One Sustainable Health, which Senegal and France are coming up, and maybe possibly out of WHO, because developing states say that this is an unfunded commitment that we don't want to do. Then there is transfer of technology and intellectual property rights. Again, most of these new pathogens and zoonotic infections emerge in the developing countries. They share their genomic sequencing and all the surveillance data. And the big pharma, which is mainly in the West, in the developed nations, they quickly develop the medical countermeasures, vaccines, diagnostics, therapeutics, etc. But they do not necessarily go back for the excess of those very developing countries where these infections emerged and who need them most. We saw it in COVID, and we are also now seeing it during the Mpox global outbreak, which mainly is happening in parts of Africa, but they themselves are struggling to get the very access to the limited vaccines. And so there is the current draft text says that some 20% of the new products should be lying with the WHO, and then WHO should distribute it based on needs. But developed countries are not in that agreement as of now. They want to dilute that text. And then pathogen access and benefit sharing is again that part of it, similar 20%. But in the transfer of technology, the diversified manufacturing in the global south, which is the main point of the developing countries, and the TRIPS agreement related compulsory licensing and greening, that is main pain point for the current draft pandemic agreement. And we will get to know this in next 1 week, because today is 4th November. By 11th November, the member states in the INB have to say to the WHO as the secretariat whether they want to have a special session of World Health Assembly this year or not. 11th November is the deadline for it. As we know, it's quite difficult, and in the last 2-3 years, last World Health Assembly May, the member states could not agree, but this kind of agreements usually take many years. So 2 years was already an ambitious timeline. It looks like that it may not happen in this week or two, this agreement or understanding that we will have a special session of World Health Assembly this year, maybe next May 2025. And then how to develop the new financing mechanism, or how to rechannel the existing funds, because there are several different agencies, different actors, different funding streams, how to synergize those under one governance or financing mechanism so that it can go to those member states who need the most. Next. So this was a basic text of the last World Health Assembly, where they extended the mandate and then a couple of other details. But now this week is actually crucial, where member states are meeting to see if they can agree for a legally binding pandemic treaty. Next. There have been several, WHO as the secretariat provides various opportunities for the member states to brings out global experts to explain different articles and its implications. The experts talk around it, and these are informal interactive dialogues where member states better understand the subject, and also informal positions of different member states. For example, some member states of African Union and European Union are discussing possibility of an emergency intellectual property framework, so that it aligns with the current WTO and TRIPS agreement, but it also takes care of emergency provisions. Then there is also a discussion about economic safeguards for the developing states. So there could be some different innovative mechanisms around it, by which, if member states agree, they can really crack this agreement within next couple of weeks. Next, please. This is the timeline and the deliverables, and
Dr.
the red
Nilesh,
font.
can we just wind
Yes.
up now? Because we're just
Yeah.
over time. Thank you.
Okay, so just the last slide. This is the red font, if you can read. 11th November is the deadline for calling a special session. So it's now within next few days, we will get to know how member states are discussing, agreeing, compromising, because if they keep the public health perspective in the mind and the hearts, then this can be agreed upon. Otherwise, it can take forever. Thank you. I will end here and back to you, Manisha.
Thanks, Dr. Nilesh, and thanks for a very comprehensive presentation. You have elaborated on all the points for IHR and also the pandemic agreement, and brought out what are the main issues and how we are moving forward. Are there any quick questions to Dr. Nilesh, because he has another meeting and he will not stay on? So I open the floor for any quick question to him before we move on. So I don't see any questions. Dr. Nilesh, will come back to you if there are any, and thank you for joining remotely from Sero. Thanks a lot.
Thank you. Thank you.
Thank you. Now over to Priscilla, and you will give us some of the details on the World Intellectual Property Organization's work in this area. Over to you. Yeah, please do.
Good morning, everyone. I'm standing because it's easier to manage my notes and pass the slides. So first of all, I would like to express my thank you for the organization and the invite. Thank you, Manisha. Thank you, all our Thai colleagues. It's a pleasure to be here and to discuss with you how we can work together to develop some strategies and foster synergies between trade health, and I would also include intellectual property, to apply to pandemic prevention and preparedness and response, but also several other health emergencies that will come to our way. So I will talk briefly about WIPO work on this field and how we can do to support especially member states. But I also would like to acknowledge the importance of this moment and the negotiations of the pandemic treaties, the pandemic treaty, and WIPO will be there to give all the support once we have the final text in terms of technical advice, resources, and support to different stakeholders, and also be a forum for discussions. I think it has been said here several times. We live in a complex time where critical challenges are intertwined, interdependent, and aggravated by uncertainty. The pandemic has shown us this. And addressing these challenges require coordination and innovative solutions while connecting multiple areas and expertises. Technological innovation is an important part of this challenge. But it's not the only one. And I would say not only technological innovation, but also services, process, policies, and how we behave and interact during crisis. And also how we innovate in the way we think on how it's possible to tackle problems. Intellectual property plays an important role in helping to solve this challenge. But also not only on pandemic, how we guarantee a sustainable development and how we have a larger view of health and how we promote a holistic view of these issues. So IP is a critical factor, and for this we need to bring a variety of stakeholders to address innovation and to promote innovation and equitable access to this innovation, because in our opinion they walk together. So in the view of WIPO, looking for lessons learned from COVID is important, and we want to help member states and different stakeholders to collaborate and coordinate efforts, because there is a lot of initiatives out there, but we also need some coordination, especially for the developing countries and least developed countries benefit. Education and effective. I will move as soon as I start. Education, effective, inclusive. Education is part of this mandate, and WIPO also wants to promote a transparent dialogue and ethical dialogue about the solutions. So, as part of this innovation ecosystem, WIPO has internally and with external partners several initiatives that I will highlight here. And initially, I would like to show you the work of the WHO, WIPO, and WTO, Trilateral Cooperation on Public Health, IP, and Trade. This initiative has been out there for many years, the past 11 years, and has built a positive agenda in the intersection of these areas. We work into different fronts. Oops, I'm sorry. And this is why, like, I think this initiative is so important, because, like, a context is key. It shows you the complex of the issues and how they relate, and how sometimes a solution will be in a different manner that might not be so apparently if we address the problem alone. So I also would like to thank my colleague, like Roger is here, Erica is coming tomorrow for the collaboration. During the trilateral cooperation, we have several fronts. So we have several resources. We'll be sharing this with you. So in some point I will pass quicker so we can have some time for discussions. We have the trilateral study. We have several publications. We did some work during the COVID pandemic that in some point we will incorporate, and we envision to do also some work in health emergencies, and actually more case study based research and publications, so we can show the impacts on the ground of these critical issues. The Trilateral Cooperation also launched during COVID a technical assistance platform that provides is one-stop shop if you want to interact with the three organizations. Before was focused on COVID, but this platform has been enlarged to any issue that's in this intersection that will range since a voluntary license to the use of TRIPS flexibilities, and is direct to member states. We will of course bring other stakeholders to discussions as needed, but this can range since legislative to policy advice. WIPO during COVID also launched a response package through technical assistance, in which we were helping countries to address problems through projects during the pandemic. And this this package also cover when it ended more than 50 countries, not only WIPO member states, but benefit other countries. And seeing the effects of the pandemic, WIPO extended this for a build back fund that we want to support countries to address economical and social issues, and also including, of course, developing least developed countries. And the Build Back Fund is a continuation, goes beyond pandemic issues, but social and economic development. And it's we'll be reviewing the end of 2025 to see how it goes. But the idea is also to do sustainable projects that can be scalable and have lessons learned to how to overcome some problems on the ground, and also reach communities that for WIPO are underserved, as women, SMEs, youth, local and indigenous communities, that innovation comes from everywhere and everyone should be included in the response. So now we have more than 30 projects ongoing, benefiting more than 40 countries in the Build Back Fund. And these projects are also tailored to unique needs and priorities, and hopes to use IP as a tool for economic growth and recovery, and also social and economic development. Because you have a range of options as a country and how you adapt the international legislation through your national legislation and policies, and you how you do this and how you use all the legal policy and tools will impact access. So here I will pass a bit quick, but WIPO has been working to provide empirical knowledge and data and technical assessments to actually assist member states to do informed decision making. So some of the publications that I want to bring to your attention are we have patent landscapes report, and with the new technologies it's really important to understand the complexity of these technologies and how you find the nuances of tech transfer, the interaction between patents and trade secrets, how getting know-how and like a knowledge transfer is like a really like not that easy in some contexts. So if you have like reliable information and technical information is trained towards this information, the response for like several countries would be better. We also have like funded several independent studies during COVID. One of them is this from Hannah Conte that shows the determinants of COVID vaccine success, and shows that even though IP has a critical role, is not the only issue if you want to actually deliver these technologies to those most in need. So we need to see like research and manufacturing capacity, funding, among several other factors. We also have like some studies in COVID vaccines and case studies that will also range from like the use of public and private fund in the development of these technologies, how the manufacturing capacity was developed. So WIPO wants to come as a source and a support to countries by giving factual and empirical information that also may not necessarily apply to your current case, but like give you insights on how to react on some challenges. This one is one of the most recent ones, like developed by the Patent Law Division, about the interplay between patents and trade secrets that came a lot along with the COVID-19 and mRNA technologies, and how the transfer of technology was not that clear or like easy to happen as some was like some players were like intending. So thank you. Like I will provide us more sources for you guys, and like the resources that like WIPO like or the Trilateral Cooperation have can be directed like to assist you, and also as a discussion forum for everything. And our main goal is like to serve as a neutral and reliable forum to discuss these issues, and we will be there like supporting any technical need once we have the pandemic agreement negotiated. Thank you very much.
Thank you, Priscilla, for your presentation and giving us all the details of what WIPO is doing, and more importantly, it's heartening to note that after COVID-19, a lot of work has been done by WIPO as well. And I think COVID-19 was a watershed in many ways for us to look at public health being most critical in terms of development across all our countries. Now it is my privilege to request Dr. Chaim to kindly come up, and we've all heard today Dr. Viroj is the person he's the vice chair, he's looking after the negotiations at the INB. So ideally, it would have been our privilege to have him tell us how the pandemic agreement is going and what are the challenges that they are facing. But we are grateful to Chaim, who has Dr. Viroj's presentation that Dr. Nilesh also mentioned during the regional committee. It was made. So I request you, Dr. Chaim, to please give us some of the perspectives that were laid before the regional committee of the Southeast Asia Regional Office a month ago. Thank you.
Thank you, Manisha. Because the time is running out, and we will distribute the material to everyone, so I will cover for only 2 slides at this time. Everyone might have heard a lot about the INB, the negotiation body to negotiate for the WHO pandemic agreement, which is the instrument to prepare for the next pandemic. It is, can I go to slide number 4, please? The purpose of a legally binding agreement. Yes, this one. So this agreement, the WHO pandemic agreement, is to promote political commitment at the highest level of more equitable, cooperative, and interconnected global system that will address the pandemic prevention, preparedness, and response. And the negotiation is looking forward to establish globally agreed principles, priorities, and targets. And also during the negotiation, the negotiation is supported to develop a constituency of interested stakeholders at the national, regional, and global level. And then it is hoping that the pandemic agreement will be committed to present and future generation that the world will not only that the world will not forget the lesson that this pandemic has happened. So there is the negotiation for the new pandemic agreement. However, the agreement has started since 2022, and it was supposed to be agreed upon during the World Health Assembly in May 2024. However, the conclusion could not be reached and the text could not be agreed upon. So there is extension of the mandate of the negotiation until now. And today, at 2 p.m. today, the 12th round of the negotiation is starting and will go on for the next 2 weeks or 14 days. So everyone can follow up that progress on the internet. And I would like to bring you to my last slide, on slide 10. And what is need? Dr. Nilesh and the speakers already mentioned about what is the outstanding point that need to be agreed upon. So we hope that the pandemic agreement will be concluded very soon, especially during this round of the next 2 weeks. And this pandemic agreement needs for the solidarity, equity, and financing, so that we can reach the good preparation for the next pandemic. And then we hope that the world can work together, as in the title of the WHO resolution, the world together, the resolution that came to establishment of this negotiating body for the WHO agreement, WHO pandemic agreement. So I would like to conclude here and back to Manisha. Thank you.
Thank you, Chaim, for giving the last words in terms of the pandemic proposed agreements, challenges, and really what we are expecting that we will be able to achieve. So with these words, I can see we are just about a minute left for the end of the session, but if there are any, maybe we can take the top 2 questions in the interest of time. Any questions to the panel? Everybody wants to go for lunch and is hungry. So if there are no questions, it's my privilege to thank our very illustrious panel. Thank you, German, for bringing your perspective from so many years, and WIPO, the excellent work that you've started, particularly after COVID-19, bringing most of your work in perspective of public health and availability for health products. And thank you, Chaim, for giving us your quick summary of Dr. Viroj's presentation. So with these words, I thank each one of you for bearing with us in this session. And over to the organizers for any further announcements. Thank you.
Thank you very much for the session. Thank you very much, panelists, and Dr. Manisha Shethar for moderate this session. This is also one of the wonderful sessions as well that we get to discuss how trade and health sectors can work together, and also the pandemic prevention as well. And this is all the morning session. And before we proceed to the lunch time, may I please announce a little bit about the lunch coupon. For the participants who have already had the lunch coupons, please proceed to the first floor at the Patumat room for having lunch. For those who haven't received the lunch coupon yet, please stay seated. Our secretariat team will be providing the coupon for you. Thank you very much. And we will have 1 hour lunch until 1:30 p.m. and we still have 2 sessions left. The session 3, we are going to talk about trade in health service for sustainable development, and also session 4, we are going to catch up about the US election. Please come back at 1:30 and see you again. Thank you.